What's up, you guys? This is Boy Miguel giving you your daily dose of radiation. Today's video will cover how well does Xray Tech School prepare you for the workforce, to push the button, to make the monies, to get the job, the hospital, or whatever you wish to endeavor. So, to give you some credentials, I've been doing Xray for 4 years, night shift, ER, trauma 3. Work a lot of overtime, so I am part-time day shifter. Oh. So I would say that most of the school will prepare you for the basic, it'll give you the, I guess you could call it the foundation. You'll have the Bible type, you'll have the Bontrager or whatever you use. You'll have the basic foundation of how to do your job. Imagine you're a mechanic, or in school where you're still learning, your ABCs 1, 2, 3. You learn all the basics of how just to be an average, to society, to the X-ray society, you could say. You just have the basic gist, and your knowledge from here on to get to where everyone who's been in the game longer here will come from both your clinical educations and where you work at, and asking old heads in the game questions. That's how you elevate to over here, which the veteran techs and people who excel at their jobs are. So once again, X-Ray Tech will teach you how to just push the button and pass the board. But to get to here, to get to the, you become a valuable asset, or you make more money up here, or a job, what's it called, longevity slash sustainability type thing, I guess you would say, on the job training. So I know you're saying, you're like, Mikkel, what do you mean by this? Okay. When you're a student, ask as much questions as you can, especially if you're somewhere where you want to work at. Try to ask every single tech different questions, because some of them will tell you just to piss off and they really don't want to help you. They'll just send you to do busy work, but other ones will give you the sauce at your job and will take the time to give you the game, because regardless of where you go, all machines are a little bit messed up, have their quirks. The rads have certain ways they do stuff. The ER doc, every little thing, they have their own little stuff. Or if you mess up, how to fix it. There's certain ways depending on if you're using certain programs. There's different little variations that everyone has. That right there, that stuff is what makes you more you'll increase your longevity, and you probably piss off less people. I would say that is very important stuff that X-ray school don't teach you. And also being able to troubleshoot stuff, learn from when maybe the system goes down, or your portable machine or X-ray machine isn't working, how to fix it, common things that mess up, and how to you do it yourself, especially if you're nighttime. You don't want to bother your manager. You try to figure it out yourself, and try to do stuff like that. So there's certain stuff that only you working at your place with time, or if other techs give you the game, or if you just get in trouble, figure it out the hard way. You learn, let me just do it like this. There's several stuff, or the work pace, or stats versus not stats, what's true stat, what's different things like that. How this should be done, or how they like it to be done. And those will be a lot of things that X-ray school won't teach you. So, because I see a lot of times like the student will come in, and I went to the same school as some of the ones that be at my hospital. And I mean, I graduated just like what 4.5 years ago. So like the majority of the knowledge and stuff that has been saved. I know like they'll switch little things in here to there because of the boards, which constantly are changing and updating. So they push different information or different information has been discovered and stuff. So I could see how some of the stuff could be changed, but some of the most basic Joe Schmo stuff, AP lat chest X-ray, like it's gonna be the same. So you'll see them how they'll perform it and how stuff is done, or they'll tell you stuff and you're like, ah. It almost becomes, you see them as like NPCs. How like basically, or like little kids who don't have, like, they just were read it, do it, but don't have, I guess, semi-imagination. Because like, especially in the ER, if your wrist broke or your elbow broke, most of the time, some of the students, especially day ones, they'll like want to do it by the book, and if the patient can't move or do that, like their brain will freeze and they can't think of how to cross table or how to use your environment to get the job done. So this is what I'm saying. So if you're doing a foot and the patient can't bend their legs, how can we resolve that? Okay. So you're like, okay, how much can you bend it? Can I grab a glove box? Can I get a box clay? You will literally engineer anything to put under that board to get that angle, to get the shot. You will literally become a little arts and craft MacGyver with tech, with time of how to do it. Stuff that just comes with time. Situationships, as I call it. So that's like some off the grid, out of the box thinking that will happen. Because sometimes you'll have to put like the Kleenex box and the other box and angle the tube at said weird angle just to get the money shot. Sometimes it's like I'll see the ER doctor just looking at us, and he was like, I ain't gonna lie, I ain't think you were gonna get that because like all the stuff you were doing, but you know what? That's a pretty good picture. And I'm like, so I'm talking about, baby. Getting the job done and like trying to hurt the patient as least as possible and keeping you safe. Cancer meter. So some of the stuff will, once again, with time, school won't teach you. You'll just have to learn type on the job type stuff. And yeah, it's been your boy Miguel. See you on the next one.